Hi everyone, welcome back to the channel. My name is Drew. I'm an accredited exercise physiologist and a registered Chinese medicine practitioner. And I kind of specialize in exercise rehabilitation, integrating traditional movement practices such as Tai Chi and Qigong, pranayama and yoga with kind of the modern approach of exercise rehabilitation science using strength and conditioning, neuroscience, pain science, understanding kind of manual therapies and how to apply them to the human body. And we're really looking at kind of creating a body that works or functional body. And to understand a functional body, we need to understand the anatomy particularly. And in this series, we're looking at the common postural types. So previously we looked at anterior and posterior tilting, and today we're going to be looking at the kyphotic type posture or the thoracic curve. In this video, we're using Muscles and Motion, which is a really fantastic app. Highly recommend you get it. We're just going to be looking at a really small piece in relation to their kind of thoracic kyphosis kind of section. So if you like what you see here, highly recommend you go and check that out. There'll be a link in the description below. I'm not affiliated with the guys. I don't get any kickback from it. I just think it's a really great app. So let's have a look here. So from the side view, ideally kind of when you're standing with good posture, you'll see here, this is the femur, this is the kind of the hip joint. If you kind of drop this kind of vertical line or this pendulum down here, I mean, old school, we used to get people to stand in front of a grid, so you can kind of do this. You can kind of see the ear, the acromion process, or the middle of the shoulder blade there, the shoulder, the glenohumeral joint. So these three points tend to line up. The elbow tends to sit just a little bit behind. There's going to be always a little bit of natural variation, but what you want to think about is the big pivot points of the body, where the bones and the muscles kind of move around each other. And so the huge pivot points here is going to be the hip joint, so where the femur goes into the pelvis. So the pelvis is going to rotate and roll around that axis. Then you've got the shoulder joint here, so the glenohumeral joint, where the humerus goes onto the scapula in the glenohumeral joint. That's going to rotate around that axis there. And then the ear kind of is almost lining up with the kind of C1 occipital kind of attachment. So the head sitting right on top of the vertebrae. So that's that kind of major pivot point there. You can kind of see it through here. Now, as we go forward, we start to see a pivot. So this typically will be a kyphotic or a rounded back posture. So the head will move forward of this line and the upper back will round out significantly. And then the shoulder girdle will move forward. And depending what's going on here, sometimes you'll see a more of a lordotic posture here as a compensate. So you get a really big archy lower back. And then as another posture type where it goes the other way and you go to more of a posterior tilt, which is sometimes called a flat back. And that's a very, very dysfunctional posture. Most people I've come across in that posture type are in chronic pain. And when we break that one down, you'll see why it's not a great place to be. So neutral is going to be somewhere around here. Let's just give these guys. So this is from Dr. Jill Solberg and Amit Gal-Alon. So these are the physical therapists who are really do a lot of the work in this app. So credit to those guys. So this is your kind of standing posture. So when you're in standing, you're going to be adopting this type of position. Now, because you're always breathing, the ribs are kind of always expanding and contracting. And so this is always moving. So it's not static. There's not really a static posture. There's this kind of like little give and take all the time. But you want to be roughly in this kind of level. And what you're trying to do is you're aligning the weight of the head to kind of sit along the axis of the vertebral column. So it's going to, all the weight of the head gets loaded down along this axis. And then the front muscles, the neck muscles, they can equally kind of stabilize and support the head. And same with the torso and same with the hips here as well. So if you move this, for example, this head forward, so the head is usually around about 5 to 6 kilos, depending on the size of the person. But as you come forward here, okay, way past that kind of axis point there, the weight going into these muscles through here really increase, times 4, times 5, times 8 times. So if your head was 5 kilos, in kind of like in terms of the physics of it, the amount of loading going into these kind of joints and these muscles might be 50 or 60 kilos worth of weight. So it just really goes up. So that means these muscles get tired and they work a lot quicker and they fatigue out really quickly. So we want to try to maintain this posture. And there's this kind of ridiculous movement in physical therapy about posture's not a thing. It's just absolutely stupid. What they've misunderstood is that posture is always adjusting because of what I said before, because we're breathing in out of time is always a movement, a subtle movement. And you're always adjusting your posture. Like you're not going to sit like a robot and just adopt one position. So static posture is not really a thing, but posture overall is definitely a thing. If you get really bad muscle imbalances, you're setting up a whole range of different musculoskeletal conditions. And whatever the current research is, I'll try to dig up the papers so we can kind of look into it a little bit. They're missing the practical application of what this really is. Anyway, so if you look at the kyphosis here, if you round forward, you can see the curves here changing in the spine. So, and now we've got some really cool common characteristics of the kyphosis. So we're going to break these down one at a time. So let's have a look at the first one. Okay, rounded back with greater thoracic curve. So this is the rounded back, and you've got the excessive thoracic curve here. And what that means is that these muscles here, the back extensors, are going to be in a lengthened position. So they're going to be weaker over time, which means that they won't be able to support the weight of the head. So it kind of feeds into itself a fair bit as these back muscles get weaker and you've got the force of gravity pulling down. Once this kind of pivot point gets past a certain point, then the weight of the head starts pulling the head forward and down further. And so these muscles, you have to work a lot harder. And what will happen is that the neck muscles will come on. So your big trapezius muscles, the big side shoulder muscles, they go up onto the side of the neck and onto the shoulders, and they're designed to shrug, so to lift your shoulders up. But they can also lift up and lock in and stabilize the neck. So then they become a lot more active, and that has lots of implications for the shoulder joint particularly, and creates a lot of restriction in the neck and the shoulders. So here we have that curve. So there's T1 to T12. So we've got the 12 thoracic vertebrae. So that curve increases. And you'll see the vertebrae here. Now, there is a condition called a Schulman's disease where the actual discs between the vertebrae, they, instead of being kind of a nice and horizontal, they kind of have a wedge, and that wedge shape makes this thoracic curve greater. And if it's got that kind of wedge shape to it, it's very, very difficult to correct. If you get onto it when kids are early, growing up through puberty, you can correct it. But once you kind of the skeletal structure is formed around the mid-20s, then essentially the skeleton you've got is what you've got. So then you just have to work with whatever kind of skeleton you have. Now, moving forward, the shoulder slouch forward and the scapula are in protraction. So as you get that rounding through here, the whole shoulder girdle goes forward. And so when the shoulder girdle moves forward, that's called protraction. And then they kind of round down. So now you're going to get the shoulder muscles that stabilize and move the scapula into adduction, so pulling back your shoulders like a seated row. They get lengthened and weakened. And remember, when a muscle is in a lengthened position for a long period of time, it can't cross bridge as much, so it just can't generate as much strength, so it's in a weaker position. And if you functionally put that muscle in that position and keep it there, it just can't generate a lot of strength. So when these muscles get to a point where they can't really do their job, the anterior muscles will take over, and essentially the body will hold the position down to stabilize, because it's got to create some kind of stability. If you don't have stability, you essentially can't move very well, and you'll fall over, or you just can't function. So you need that stability first, and then we try to put mobility on top of stability, and then we build strength from there. Now, there's always an interplay between the three. Sometimes, like, we need strength first, so we want to actually get these rhomboids and medial traps stronger, and that will then create the mobility, so pulling the shoulder blades back, and then that will give us the stability as well. So depending where we are in the posture, sometimes we need to start with strength, sometimes we need to start with mobility, sometimes we need to start with flexibility, sometimes we need to start with just stability, and sometimes we need to do it all at once. Okay, so next part, then the head tilts forward. So you've got this forward movement of the head, as I said before. So you've got the bowling ball sitting on the C1 axis here. As that goes forward, it increases the work the muscles have to do here. So you've got the extensor muscles, you've got the scalenes, you've got the trapezius all attaching onto the base of the skull here and along the vertebrae. And so that creates a pulling and a tension or a torque, and you can get kind of pretty nasty kind of headaches and upper neck, shoulder issues from just that forward head position. You also get a lengthened sternocleidomastoid initially, then it goes in a really short position. So this front muscle here, the SCM, gets shorter, and because it attaches just here and goes down to there, it's pulling down this way, and it kind of like tilts your head up even more. And one of the key principles in posture is that the eyes need to be kept level. So your eye sockets, your eyes, they always need to stay level in a horizontal plane, so the body knows where it is in space. So what will happen is that the body will compensate and move your head to make sure that your eyes can maintain that horizontal plane. And so essentially, if your head's in this position, the rest of the body will adjust to keep your head in that nice level position. So as you straighten up, you can maintain that posture a lot more efficiently and effectively. We get thoracic rigidity and stiffness, mainly in extension and rotation of the thoracic vertebrae. So let's look at the animation here. So that's our posture there. I'm trying to get into extension. So extension means straightening up, so back bending. Essentially, you get the stiffness and the rigidity there because you're collapsing in onto yourself. All the little intrinsic muscles go up the spinal column and get weak. So like things like your rotatores, your multifidi, and the segmental thoracic extensors, they all get lengthened and weakened, so they just can't pull you back into extension very much. And then the joints get stiff. So joints need mobility to lubricate. They release synovial fluid into the joints like an oil, like a WD-40, and so they're not getting lubricated, and so they stiffen up even more. So then the spine gets into this lock position. And when you're in what's called a closed pack position, so when you are fully flexed forward, the space between the joints get closed down. And so then when you try to laterally flex or rotate, so side bend or rotate, you can try it. So if you kind of like curl into a bit of a ball and then try to side bend, you can't go very far. Like you're just kind of stuck. All right. So you need to kind of come back up into extension and then the side bend, because you're creating the space essentially between the ribs here definitely, but like between the vertebrae. And then even more so, like if you kind of like curl into a ball, like you're doing a sit up in the chair and then try to rotate, you kind of can't rotate. It's because the vertebrae are fully closed down and they're actually bone on bone, as in like the end range of movement. So like they just don't have any more range to move. So what happens then is that in this kind of middle section of the thoracic, because that's not going to move very much because it's kind of getting very stiff and rigid, then you have to get more movement from the neck and from the lumbar spine or the hips. And so then you get excessive wear in the neck and shoulders and excessive wear in the lower back. And so then you can kind of get these problems above and below the thoracic spine. Sometimes the thoracic spine is called T-spine. So if you hear that kind of term, that's what I was referring to. Okay, next one. And we're looking at tilting of the pelvis. So if we go back there, we just missed that. So we'll just take that back. Let's see if we can show it. We're going to show it. Let's go animation, show it, go. Shoulder resting forward, tilting the pelvis anteriorly. So that was that kind of anterior tilt that I was talking about. And then here, if we pause here, you can see if you're lying down on your back, this big thoracic curve means that their head is actually in a high position. So it's really uncomfortable for people who've got big kyphosis or rounding on the back to lie down on their back. They often need a pillow underneath them to support this big space between the neck and the head. I have one of my clients, and she's amazing. She's done such a great job training. But whenever we come down onto the ground and we do our kind of like core work, we're doing sit-ups and things like that, because we want this anterior core strength, we have to have like a fairly big bolster just to support her head, because you just can't get a head on the floor. That's quite common. You'll also get this big kind of curve through here as well. So just be aware of that if you work with people who've got that kind of kyphotic type posture. So you can see the chin's up, scapula's in protraction, it's kind of rounding forward, and this is important here, anterior arm tilt, mainly because of the shortening of the pectoralis major. So you can see here, as you go into protraction, essentially that rotates the shoulders forward. So you get what's called internal rotation of the humerus, and that shortens all the muscles on the front. So the pec muscles are internal rotators, so they're going to tighten up and they're going to pull your shoulders in a little bit more. So they're going to create that stability for you on the front, which is not necessarily a good thing, because then you want to open up to get into your back muscles. It's hard to get there when they're tighter. So it's all about this balance. It's just kind of like a left and right, front and back, up and down balance that we're trying to achieve. So this is a really good animation here. You can see it when you're lying on your belly. When the deformation stems from a structural source, it is more prominent when lying down. So when your structural means the bony source, where it's functional means muscle imbalance. So like if you have that Schulman's disease, for example, you lie on your belly, and you can just see that it's really going to be prominent in this position here. Okay, that's just something to be aware of there. You really, the only really way to kind of identify that is to get imaging and x-rays done. So here we have a great example of the rotation that we're talking about. So rigid kyphosis is also prominent here during spinal rotation. So we go back. Give it a second. See, a little bit hard to see. So what you want to look for here is you can see the vertebrae in the lumbar spine moving, and then the thoracic spine don't move. Right, let me take it back before we get to the chest. Oh, back a bit further. Here we go. Yeah. See, this section here doesn't move at all. Go back again. Doesn't move. All the movement comes from the lower back and the neck. So there's a really cool cueing that we do in a lot of yoga classes, and you'll see it in Pilates as well, is when you're trying to go into what we call a twist in yoga or rotation, you go into axial extension first. So you inhale and lengthen the spine. So you come into extension, not a back bend, you just straighten up. That creates all the space between the vertebrae, and then you exhale into the twist and the rotation. When you come out, you inhale, come back up, and then you exhale, relax. So you use the inhale, because inhaling is natural extension or straightening of the spine, and exhaling is natural flexion and rotation. So you're trying to coordinate the in and the out with the breath and the movement of the spine. Okay, let's look at the pec muscles. Chest muscles, pec major and minor, are short. So that's a great illustration right there. That's essentially what happens. So you get this real shortening of these huge pec muscles. This is the sternocleidomastoid muscle I was talking about before. This is your upper trapezius muscle. So this is your pec minor here. So 1, 2, 3, 4 muscles go super tight when you get into this kind of rounded back posture. Now think kyphosis posture as well as like your sitting posture. So like you're doing a lot of work at a computer, the kind of text neck posture, a lot of driving. I don't know who designs the car seats, but they all design car seats to put you in this shape, and it's just horrible. Particularly if you do a lot of driving, you get a lot of tightness and stiffness in this area through here. Cycling, a lot of cyclists tend to adopt this posture because they're in this kind of slightly rounded posture. So cyclists tend to get very tight in the chest, in the neck, in the scalenes. So they're in this posture and then they look forward. So they get really tight in their neck through here as well. So they need to do a lot of kind of just mobility and kind of joint work to kind of maintain the health of their upper back, particularly. But this is a real problem here because this muscle is really, really strong. And if you get kind of into that position where it's there all the time, it'll adapt to that tight and strong position and it'll reciprocally inhibit, which means it relaxes the back muscles on opposite. So the antagonist muscles to your pec major is going to be your rhomboid and your middle trap. So they're going to get weakened. And so that's going to feed into that posture and it's going to create a lot of problems for you. So here that's where we want to get to. We want to get to extension. So the way to get to that is we've got to train those tight muscles in the back. So you've got to do lots of back extension work. You've got to do lots of rowing work, lots of pulling work. You've got to then do a lot of mobility and stretching of the chest, or you do lots of kind of weighted mobility. So like a dumbbell chest press, and you go right down as deep as you can, feel that big stretch through the chest, and then you're going to press out of it. So lots of really full range weight exercises, light weights to start. But if you do your resistance training correctly, you're getting great mobility, strength, and flexibility all in one. So strength training done correctly, like the knees over toes guy is fantastic for that. His work is brilliant for that. Full range of movement to your control, to your pain-free range. Okay, and then just be patient and just keep getting the reps up, and you'll basically create strong, lean, long muscles, which are super functional. And the time my body feels the best is when I do that kind of training integrated with some cardio and my kind of Tai Chi Qigong yoga kind of practice. So that's the best. Here, that's not good. Tight, yuck, don't want that. And then we get weakness in the deep erector spinal muscles and then scapular retractors. So all these back muscles here. So we've got lower trap muscles, middle traps, okay, rhomboid muscles, and then go up the upper traps up through here. You've got the quadratus lumborum, your multifidi muscles through here, your extensor muscles coming up into the ribs. These are all get placed in that long position, which means that you just struggle to get that back strength. So the one way to kind of rehab your back or get strong back is to actually train the muscles in the back. You really do need, if you do have a big kyphosis, you probably need to be working with someone who really knows what they're doing, because if you go into the wrong type of back exercises and you're not doing the other work as well, you might need some manual therapy to release muscles that are really, really structurally just tight and hypertonic and just holding. You might need to get someone to release them for you. There's a bit of a kind of nuance to it to get into it. If you just kind of jump straight into those back bends, you can get some pretty gnarly kind of upper back pain, some neck and shoulder pain, just because like you've got all this tension in the body and you're trying to resist the front's trying to work against the back, and it needs to have a real balanced approach to do it effectively. And greater curves may create in the cranial and lumbar vertebrae as well as a result of the body compensatory process. So here we get that increased cervical lordosis. So that's where the head gets poked forward. And then here we get the increased lumbar lordosis, so a bigger lumbar arch. So that puts more pressure on the neck joints, puts more pressure on the lower back joints. So what often happens is that the thoracic is, when it gets in that kyphotic position, it's a really, really strong position because all those joints are closed down. And so it doesn't rotate and you don't twist too much with it or side bend. So it's really strong in the sagittal plane. There goes my phone. Let me turn it down. So the excessive movement comes from the neck and the lower back, and they typically have a lot more freedom of movement just because of the nature of the vertebrae and the shapes and what their role is. And so you'll often see people who develop neck problems or lower back hip problems as a result of their weak middle back. So it can be a huge issue for the spine. The best way to fix your back is to train the whole spine. Just don't focus on one area. Okay, and probably the last one here, short cervical extensors and the sternocleidomastoid. So here we go again. So we've got your cervical extensors muscle groups here, and then you've got your sternocleidomastoid, again, feeding into those big four muscles on the front of the body, which get super weak. So that's a huge difference between this posture here. So their neutral spine versus here. Okay, that's your forward episode posture. And just look at the length of the muscles as well. So when you come back, see how they lengthen? Like as you extend the spine, they get stretched out, but in a controlled way. This is what we call eccentric strength, because gravity is still trying to pull this head forward. So these muscles eccentrically lengthening under load. And so that's a really strong position for a muscle to be in. Yeah, so this is bad. This is normal range of movement. That's normal range. You should be able to do that, but you don't want to be stuck in that position. So you should be able to look up. So essentially that's you trying to look up. Okay, you should be able to do that and look fully down. So you want the full range both directions, but you don't want to get stuck in that position. That's not cool. You don't want that. Don't get stuck there. That's bad news bears, people. And then lastly, but not least, let me move me out of the way. Short superficial breathing muscles because of limited chest cavity mobility. So this is super important in breathing exercises and respiration. So the lungs sit within the rib cage. You've got the lungs on the left side, lungs on the right side. You've got the diaphragm here. So what happens here is when you breathe in and out, is it going to show? Oh, it didn't show me. So I'll go back. So on the inhalation, the space between these ribs, on inhalation, the space, my God, frustrating. Pause. Okay, on the inhalation, the space between these ribs expand. And that makes sense because you're going to breathe in, you're going to blow up the lungs. So like when you breathe in, it's like inflating balloons, so they get bigger. So you want to create space in the rib cage to get more air into the lungs. That's cool. And when you breathe out, the intercostal muscles, they pull the ribs back down, and that helps to reduce the thoracic space, and the diaphragm then pushes back up, and that decreases the volume in the lungs, increases the pressure, and then it pushes the air out. So that's how you breathe. Now, if you're in that rounded posture, what happens is that those intercostal muscles, they are already in a closed position down. Okay. So mechanically, it just close down. And because you don't have a lot of movement in your spine because it's stiff, you don't get a lot of that rib movement. So you can't really create big shape changes in the rib cage. And so then you can't get air in and out. The ventilation is really, really reduced. So you get kind of like short, puffy, short out of breath easily. You tend to be a real big kind of chest thoracic breather, which means you're going to use more of these upper traps and these scalenes. So you're not going to get air in down to the lower lobes of the lung. It's going to be all up here. That's a problem because you get more oxygenation and more diffusion of oxygen into the body when you can breathe deeply down into the lower lobes of the lungs as well. So you just don't get as a good flow of breath in and out. And that's a real problem. So a big part of learning how to breathe is to learn how to go into extension, so back bend and flexion, forward fold, and then side bending, so lateral flexion and rotation, so that you can kind of get air into all parts of the lungs. There's a really cool Qigong practice in the medical Qigong series, 5 Elements, when we bird. And the whole kind of practice was orientated around training people how to move through their thorax and their ribs with the breathing. So you get all of the ribs moving, and then you're trying to get oxygen into all parts of the lungs. So you get good airflow or ventilation in and out. So a really cool practice. It looks quite simple from the outside, but when you get the kind of concept of it, you feel amazing. You really get a really good breathing pattern going. I actually do that breathing technique with a lot of my COPD clients. So when I'm doing kind of like respiratory rehabilitation, kind of use a lot of those principles from Qigong, because Qigong is very gentle, it's very soft practice. It's good for people with breathing issues because they can self-regulate. It's really good. So we do the mechanical part there. We're teaching people how to use their spine. And if someone's got that kind of functional kyphosis because they've been sitting a long time and their muscles are weak, you can definitely correct that posture with the right exercises. You can change people's postures, which means you can get people out of chronic pain, which is amazing. But if people are got the structural problem where the bones have actually fallen in those positions, maybe because they had Schumann's disease. We can't change that, but what we do is we try to optimize the range of movement they have and try to keep their upper back muscles stronger so gravity doesn't win and just pulls them forward. Because I do have a couple of clients, one at the moment who's got a severe kyphosis and scoliosis and is having major surgery because she's just basically collapsed down and can barely breathe and is compressing some of her vital organs, things like that. So you don't want to get to that level. It's quite serious. But she's great. She does a lot of exercise. She does what she can. Like, attitude's fantastic. It's funny, a lot of the rehab that I work with, people have really significant issues and conditions, and the attitude people have is often dictates the outlook of their life, which is super interesting. So people can have really quite severe health injuries or conditions, but they have a really positive mindset and they work with their body and they accept their limitations and they do have some responsibility to keep working what they can do, and they tend to have really great results. And then people who then have that victimization, kind of like they blame everything else apart from them, they often don't do too well. So part of kind of exercise and rehabilitation is just accepting your body for what it is. We're all different. We've all got pluses and minuses, strengths and weaknesses, different experiences, and we just work with what we've got and we build from that. So hopefully that gives you a good idea of kind of kyphosis. Key points is you don't want to let gravity win and pull you forward. Posture is definitely super important. We're not meant to sit in static positions where we're holding. We're always making little adjustments because we're breathing, because we're always slightly moving. So there's always this kind of dynamic posture. But when our exercise program, we're looking to optimize the muscular balance, particularly on the back, because we have a tendency to go into forward flexion, which then creates a weakness on the spine. And then if you get into the upper round posture, then that creates weakness in the neck, it's in the lower back and hips, and that can be an issue for a lot of folks. But there's always something we can do. So hopefully you enjoyed this video. If you did like it, do a couple of things you can help me out with. One, like, share, and comment. That really helps the channel grow. Also, go over to Muscles in Motion, to the App Store over there. There's a really, really good subscription, well worth the cost. Support those guys. They're doing fantastic work. And if you have any specific questions, you can always drop a question in the comments below, or you can drop me an email. I'm happy to kind of get back to you with an email. If you're looking for more specific work, I do telehealth one-on-one consultations. So you're more than welcome to reach out. And if I can help you, I'm more than welcome to help you out. Otherwise, wherever you are, keep straining, keep studying, keep learning, stay curious, be humble, and have a great day. Copy the share.